Yes, good morning, students. Today we are going to start our fourth chapter of plus 2 class biology, and the name of the chapter is reproductive health. In the part 1 of this chapter, we mainly cover three main topics. First is reproductive health, second, population explosion, and third, birth control. So, let's start our first topic of the day. First is what is reproductive health? What do you mean by reproductive health? Simply, health is the state of physically, mentally, and socially fit. Health can be defined as when an individual is physically, mentally, and socially fit, then the individual will be termed as healthy. Or in the lower classes, we have already discussed about what is health. Then we simply write that absence of disease is known as a healthy individual. So, if an individual wants to have a healthy reproductive life, so he and she should have physically fitness first, emotionally fitness, behaviorally fit, and socially fit. If the individual has four fitness properties, means if an individual is physically, emotionally, behaviorally, and socially fit, then he and she can be assumed or can be undertaken as a healthy reproductive life. Now, according to WHO, WHO is World Health Organization. According to WHO, reproductive health can be defined as a total well-being in all aspects of reproduction. Means if an individual is healthy in all aspects, all you can say all features of reproduction, then he and she can be termed as a reproductive healthy individual. It should means the individual should have physically, emotionally, behaviorally, and socially balanced life. If one of the feature is missing, the individual may not uh, lead a healthy reproductive life. Social fitness also play a very important role in the you can say healthy reproductive life. Behavioral, emotional, if the individual is emotionally you can say disbalanced or emotionally not stable, then it may affect its reproductive potential. So next, reproductive health problems and strategies. What are the problems regarding the reproductive health in our India? India is a big country and India is overpopulated country also. So it is a very important you can say a crucial parameter that must be followed by all the individual to have a good reproductive health. First problem of reproductive health is overpopulation, large size population, uneducation, you can say poverty. These are some problems that may affect the reproductive health of a society or of an area. So Indian government puts or you can say released some strategies regarding different uh, programs or different strategies that must be followed for the individual or for the society, so he or she or the society can have a balanced reproductive life. And India is the country which initiate the action and initiate the planning to attain the total reproductive health as a social goal. So in India, family planning program was initiated in 1951. In year 1951, family planning program are initiated in India just after the you can say independence of India. So in family planning program there are various parameters are followed, there are various uh, procedures are followed by the government to have a healthy reproductive life in the society. So there are new improved programs are also released by the Indian government, and some of them are named as Reproductive and Child Health Care Program (RCH), and these programs mainly stress on the how the child health can be promoted or can be increased or can be provide very good atmosphere for the newborn, or for the, you can say, have a good health facilities, or for having a good health infrastructure. These programs mainly lay stress, and these programs also create awareness about various reproduction aspects. Awareness means they organize some programs, they organize some nukkad nataks, and they give some slogans also for healthy society. And some programs are also initiated to provide facilities and support to build a reproductive healthy society. So next, now what is population explosion, and what are the various method of birth control? Population explosion is, you can say, increase in size and growth of human population. When a population increase drastically, or when the size of a population within a limited area increase drastically, then it is known as population explosion. India at the time of independence, it has near about 350 million population, but in May 2000 it crossed near about 1 billion population. So Indian population increased rapidly in multiple times because of uneducation, poverty, illiteracy. These are the some factors that may promote the population growth. Even the society is unaware about the after effects of population explosion. If the population increase rapidly, then it will create a pressure on the food, because suppose food is limited in an area, food is limited in an area, and it is limited for the people also. If the population increases rapidly, then the food productivity will not increase rapidly. The amount of food will be for the few number of individual, so rest of individual will not get a proper food, will not get a proper shelter, or will not get a proper clothing. So these are the, you can say, various drawbacks of population explosion. Next, if the population increases rapidly, then unemployment may take place, or shelter problem may take place. Shelter is the area where an individual reside, or society, or the area, or the house. Shelter is that area. So population increase rapidly, the area will be congested. So health facilities also degrade in the overcrowded area or overpopulated area. So what are the various reasons for high population explosion? Means why population increased rapidly in the past years. First main reason is decline in death rate. Decline in death rate. Death rate means number of individual uh, died per thousand of individual is the death rate. So death rate decline in the past few years. Death rate decline, so ultimately the population will increase. Ultimately the population will increase. Second, longer lifespan. Health facilities in Indian countries now increasing rapidly, and advancement of scientific research and scientific studies and various new technologies are introduced in India for the treatment of various death causing disease like cancer, like you can say diabetes. So in India, health facilities and health infrastructure increases day by day. So the lifespan of individual also increases. Why is it so? In the previous past years, when just after the independence, health facilities are very poor in India. So suppose an individual having an infection or having an infection in the respiratory area, so he or she will not get proper treatment or may die. But in the today's scenario, we are more advanced, so normal infection we can easily cure. Even in case of cancer, there are various therapies are also available in India which increase the lifespan of the patient. So second point is longer lifespan. If lifespan increase, then the population also increase. So second point is covered, longer lifespan. Now third is decline in maternal mortality rate. What is maternal mortality rate? Maternal means mother. Mortality means death rate, mother death rate. When a pregnant female delivers a baby, then sometime due to some uh, health factor or some changes in the female body, or the female is very weak during pregnancy, so it may lead to the death of that female. So it may lead to the death of that female. In the past years, just after the independence, so health facilities are very poor already. In the second point we already discussed this. So during the parturition is the process of delivering a baby. During the parturition, female sometime lost his life. But in today scenario, the difference is much more. Means health facilities are good, so maternal mortality rate decline. Maternal mortality rate decline, so automatically population explosion will take place. Next step is decline in infant mortality rate. Infant infant is the, you can say, the child which take birth is known as infant, or the starting stage of life, near about 1 year, you can say. This period is known as infant period. So there is also a decline in the, decline means decrease in the death rate of infants. Death rate of infants decrease, so automatically population get increases. And reason is same, health facilities are improving day by day. Next, some religious belief against the birth control. In some countries there is a religious belief that avoid birth control, means they are against the birth control devices. They are against the birth control devices, so they do not adopt the birth control devices. And in that country, one couple have more than 2-3 babies, so ultimately it will increase the population of the world. Next point, lack of reproductive health knowledge. Yes, this is also a very important point for the population explosion. In some countries or in some parts of Indian country or India country also, there is less knowledge about the reproductive health. So they are not aware about the consequences, or they are not aware about the after effects of population explosion. Population increase drastically, so they are not aware that it may create a stress on the food, or it may create the stress on the shelter, so they multiply rapidly or they increase their population rapidly. This is also the main reason behind the population explosion. So these are the some points regarding high population explosion. Suppose in exam, the question is that what are the main reasons behind the high population explosion in India? You must mention these 6 points. First is decline in death rate, lifespan increase, maternal mortality rate decrease, infant mortality rate also decrease. Some religious belief are against the birth control devices, or there are lack of reproductive health knowledge. So this is all about in the part first of human reproductive health. In the second part, we will cover about birth control devices, which is the main or which is a very important topic for your board exam also. So thank you for the